Good afternoon, everyone, and welcome to Mirus Australia and ManAd Plus, a special introduction to the new enterprise ecosystem of Mirus and ManAd. Today, joining me on the call is the individuals from ManAd Plus. We have Ben Sturziker and myself, Robert Trevino, Director of Mirus Australia. But before we begin, let me acknowledge a welcome to country. And we acknowledge the traditional custodians of country throughout Australia and their connections to land, sea, and community. And we pay our respects to the elders past, present, and future, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. And whilst we have some of our team members attending to the chat, please feel free to ask questions as we go. We will have Jackie from ManAd Plus reporting and taking some of your specific questions, and we'll also take note of these as frequently asked questions and circulate as part of an ongoing narrative and dialogue around the roadmap of Mirus Plus. But today, what we're going to be focusing on is an overview of, firstly, Peter Staples and the history of ManAd, or Management Advantage, and certainly more details around the Mirus Australia and ManAd partnership as we continue to align our organizations and develop our technologies to support the industry through this post-reform and also into the new aged care standards. We'll also tie that into very specific customer benefits, also allowing for you to have a question and answer with all of us, and then share with you some additional offers that we have that the ManAd Plus clients can take advantage of. And we will close out today roughly at 12:30, and apologies for the late delay. Now, Ben, I'm going to throw over to you. We have a recorded overview and some words from Peter Staples, but just in summary, one of the outcomes that really stuck with me with Peter is that this quote by Isaac Newton, which is, "I've seen further than other men. It's because I've stood on the shoulders of giants." And certainly the history and the impact Peter has had on our sector, being Australia's first Minister for Aged Care under Bob Hawke, also the Minister assisting the Treasurer for Prices, so it sounds very similar to the HIHACPA body today, as well as the godfather of our original sector reforms and the start of the original Aged Care Act, which he shares there's been four rounds of standards now that we've gone through during that period of time. And he's also served as Australia's first Aged Care Quality Commissioner and founder of the Therapeutic Goods Administration, or TGA as we know it. Dan, I know we have got a pre-recorded video or audio from Peter. I may just click over and pause mine if you can take that over and share.
Let me just check, Rob. I'm not sure if I've got that available. Let me just see. Otherwise, we might need to share Peter's recording posts.
That's not a problem. And whilst you look for that, I may just then give a brief update then on Mirus first, and then we can come back to the ManAd Plus overview from that front. But for those of you who are new to Mirus, who is Mirus Australia? And well, specifically, Mirus Australia is focused on providing software and specific advisory consulting solutions for the residential aged care and home care markets of Australia. And really, we focus on utilizing data and insights to help providers manage operations and sustainable financing. It also is to our area that we continue to support the sector through a lot of our data aggregation efforts, which now are benefiting providers with much more relative comparison of operations, but also we use that data with the advent of new technologies such as artificial intelligence to also run a lot more of automated business processes and workflows, such as automated care activity statements or national quality indicator reporting outcomes. And so our background is really on a data and innovation lens with very specific technology that we build as really niche products for the regulatory requirements of Australian residential and home care. So we want to share to you with a little bit more about the future and what we have. And Ben, what I may do is give an overview of really part of what the Mirus side of it, and then if you want to add into then the plus side, but really together, we're now working on our future, the future of a post-reform operating system that Peter and Ruth had designed over 30 years ago, and is up there with one of the oldest software companies in Australia. And we're just so excited to add on to our legacy. Is now a 15-year company in that side. Well, really what the vision of Mirus Plus is for us, and it comprises effectively the ability to ingest, standardize, and manage data from all applications and silos across organizations. And this not only resolves longstanding silo problems, but also positions companies to harness cutting-edge advancements in agentics and AI, which is really part of the future of efficiencies and having software do more in the form of labor that our direct care teams have to carry. Now, by integrating these technologies, providers such as yourself can significantly enhance their workflows and streamline tasks that once were very labor-intensive and manual. And Mirus Plus does more than just streamline our operations. Consider a world now that will help create a culture of care and innovation within your organizations. As a proud Australian-owned solution, Mirus Plus is designed by Australians for Australians and with the Australian residential and human services sectors only. And this emphasizes on the local experience that all of you bring into the co-designing as what we refer on our product marketing engagements. And ownership fosters a sense of pride and commitment amongst the teams. And a lot of our clients do wear their colors of ManAd Plus proud, and same with the Mirus clients on that side. And by investing in Mirus Plus, organizations can demonstrate to their staff that they are valued and equipped with the best tools to succeed in the future of aged care operations, enhancing their reputation as employers of choice in an increasingly competitive landscape of talent acquisition. And in conclusion, really what Mirus Plus is from our vision, and I'll hand over to Ben to give a bit more on the ManAd Plus side, that it's not just a software solution that we're putting our attention to and building. It's a comprehensive approach to really transforming our aged care operations in this post-Royal Commission landscape. And by ensuring all of your data is smoothly integrated and accessible, we want to empower you to navigate today's challenges and seize future opportunities confidently. And together with both organizations and with yourselves, we are building an Australian future that values innovation, teamwork, and dedication to excellence in care. Over to you, Ben.
So thanks, Rob. First of all, I'll just apologise for the audio for anyone that wasn't able to hear that. We have got a recording that was meant to be embedded, but some technical difficulties prevented that. So I apologise if that wasn't clear for everyone. What we'll try and do is send out that recording of Peter's message, so that way you can also listen to what he had to say if you're unable to hear that. So apologies for that. But yeah, it's very exciting from our side, Rob. We've obviously got two projects. So in our world here, we've got our current project. So I'll just touch on that. So version 5 that everyone's currently using now. There's a lot going on. Obviously, we're all aware of the Aged Care Act and the standards that are coming out. So currently we are planned to have another release on the 2nd of June. So 5.19 we're up to now. So we'll continue to build on features for the new standards and the Act. Care document templates going in there. And obviously the biggest feature release of that will be subject to obviously the legislation, which we're all holding our breath for, is for our optional finance module. So there'll be a lot of changes that are planned in there. So we're on top of all of those. So RAD retentions, DAP indexing, the replacing of additional services and extra services with the new higher everyday living fees, replacing of means tested care fee with a non-clinical care contribution fee, and then the hoteling supplement contribution as well, among other things. And we're also waiting on Russell Kennedy to update us. So those users of our finance module, they'll provide to us updated templates, but like us and everyone in the industry, we are holding our breath and waiting for that final legislation to come through so they can update their legal templates. And we can also make a number of changes to our finance module, along with other areas in the clinical modules as well. We've then got another release that will be planned for early July. So there'll be the rate updates, the traditional 1 July rate updates, as well as any other remaining features. As we're all aware, the department seem to be drip feeding a lot of information, and not everyone's always aware of what's coming, and then they just announce something. So most likely there will be, after that sort of 2nd June release, another one in early July, as well as the My Health Record transfer summary, which we're also working on as part of that project. along with a mobile app platform update as well. So there's a lot happening. If there's anything that you need in regards to the current version, the current changes, things you're unaware of, by all means, reach out to our help desk team, reach out to our client managers, your dedicated client manager, ask them questions, or if there's any feedback or suggestions, we're always open to those as well. And then we've got another project. So the one project we've got off to the side is our web project, which we're really excited about. We've built out a whole new platform. So essentially there's a web platform created and built. And what we're doing is going through feature by feature and bringing across all of those ManAd Plus features now into what essentially we're calling version 6, which is our web project, and building those in. So feature by feature, we're going through each of them, looking at the interface, the user experience, maintaining consistency with what you're familiar with now. So that way, when you eventually come onto our web platform, it's very, very similar to what you're familiar with. But we obviously know that we can always improve and enhance the applications. Software is always evolving, and we're doing the same. So we're also reviewing every single feature as we bring them across of how we can enhance it, how we can make it better. Always open to suggestions as we are here. So let us know if there are feedback requests that you have for our new web project. There'll also be previews coming. So there will be previews. So we'll start taking you through highlights of that once we've got a number of features to take you through and key things that we can highlight to you. And then the plans are that we'll offer this as a true SaaS, software as a service product. As well as looking at host your own options. So we're definitely aware that there are a number of organizations we work with who have invested in their own cloud infrastructure already, invested in their own server equipment, their own IT departments. So we will be looking at that hybrid option that you can obviously go down as pure SaaS model where we can host that for you. Or if you want to host it in your own infrastructure, also a model where we'd be able to do that. And then obviously the tie-up with Mirus. So integrating Mirus's products, so their admissions, their metrics, their care minute manager, and the rostering, which again is a feature I know a lot of our clients are probably very keen to look at, to go down that path where we've never had a rostering solution built into our ecosystem of products. And then over all of that is a one secure logon, one secure user account, and access to all of those products. So that is, I guess, the direction where we're going. And again, always open to feedback, suggestions, requests. Please send them through.
That's excellent, Ben. So just a little bit on your plate and the roadmap. So certainly it's got some work cut out, but no, it's really exciting. So having ManAd now officially available into the cloud environment, as well as a on-premise solution to continue really some of the specific data sovereignty and other specific ICT strategies that groups still want to have that in-house to offer, which I think is really what will make us stand out as an organization, because having that flexibility for the likes of the different types of clients we service is very important in the future world of operations. And I guess to just give a little bit of an insight of what's to come on the innovation roadmap, we will be continuing to put the data that we spoke about to work. And one of the actual future innovation projects that we're working through with a client at some research institution is really the ManAd Plus's first feature innovation of what we're working title is the Nolan intervention. And this is really cutting edge use of how AI models can actually generate avatars for specific family members. And this one is of myself. It's not actually me. It's AI Rob, which you called as Roberto. But this was a innovation piece around supporting our staff with the behavioral escalation intervention, to support those care teams and the loved individuals we provide care for.
What do you, Rob? Rob, audio. Okay.
No audio. Oh, sorry. No audio was going there. I guess I'll have to, let me just see. I may have to come back to that one. I don't know if the audio is on.
Not having much luck with our tech today.
We'll come back to that. We'll share that video as well on that front, but the audio on our Zoom is not working as well. But yeah, that's really exciting, because what that means for us is that we continue to leverage our data insights and a lot of the expertise we've been working on with projects with the Department of Health, the Digital Health CRC, and now really lean into more of that on top of the ManAd Plus ecosystem. The other aspects that come is that innovation and investment to really accelerate, but also enhance the technology to continue to meet your needs in a future operating model of the newly defined, I think the ink is still dry as we see it, but of the new aged care standards. And that's very important because that's also where the legacy and history of ManAd, Management Advantage, came from in terms of a complete management system to help providers run sustainable, but also compliant to the standards of the last, really now, over 3 centuries. Sorry, 3 decades. And specifically on the Mirus side, we want to allow and also provide access to a lot of the wider managed services that our teams have been providing to the sector now for approximately 15 years. And in today's environment, that's really around supporting of organizations to meet their funding and care minute performance, the full tracking, the full achievement of that desired star rating, and to minimize the overspends that we see a lot of groups going through those regular operating cycles of having to deploy commitments into the future with rostering, but then having to react to that in really near-term phases to get through those 3-monthly QFR periods. And then really the last continued elements that'll be in it for the wider groups is our integrated solution stack. As Ben noted, we are bringing more insights around the funding, the compliance, the workforce operations, the care minutes, that connection with Medicare, and how it links to each of your individual operational needs and more. And we also have a long list of further roadmap features such as the Nolan intervention and some other research institutions that are getting behind a lot of these integrated feature sets with also those academic papers to continue to support and enhance these types of solutions for not only just ManAd Plus clients, but eventually the entire sector. And last of all, we are continuing to bring to you the same dedicated team that you're familiar with specifically more added resource to enhance that experience. We understand this time is challenging for everyone, for us, for the ecosystem that supports the sector, for your residents, and ultimately for you and your staff. And so certainly through these times and through these periods of change and transformation, we understand some of the challenges you're going to be up against, and so certainly a lot of our training around your account management and other dedicated consultants is really focused on bringing the latest of what's happening from our contacts at the Department of Health, but also what's happening from really the ecosystem of the hundreds of different providers we're speaking with each week that we can share and continue to lean on everyone's experience so that we all win. And perhaps at no additional cost, some of the immediate areas that they will be bringing and focusing is that Mirus is an ISO accredited security standard. So we'll be on a roadmap now to extending that certification through to the ManAd Plus clients. We also will bring the benchmarking, analytics, and the reporting for the entire sector that we have to help optimize operations. And that's everything from capital management reports and property reports around RAD achievements, DAP achievements, everything that now is so rich in the My Aged Care portal that we connect with and that we can now offer you as comparisons or individual specific reports to help drive and test some of the hypotheses that your exec teams or even boards are asking you to explore. And excitingly, Ben, we are also moving to a 24/7 level 1 customer support, and that would be a combination of the dedicated email support channel, some regular online chat forums, as well as a 1-300 number to, again, continue to support your teams through this transition and to ensure that all of your operations and your use of the new system as we navigate the July 1 adaptation of these business processes into the system, that your organization is making the most of them. And last but not least, this is just one of many of our leading webinars, thought leadership, other user forums and events that we're having. as well as ongoing training and other free and discounted offers that we extend to our base of clients. And certainly we take all of your feedback and comments very seriously, and those actually drive further areas for us to focus on with the data sets that we hold. And so today, what we're also offering to the clients is really a hot topic today, Ben, of what we are continuing to support organizations with, and that's really around the total funding and care management solution. Being able to really track and achieve those star ratings and not do it with the overrun that we're seeing a lot of groups racking up in some of those inefficiencies in this new complicated landscape of funding with also a time application and also with a constant case mix of ebbs and flows across your facilities. And so this complete solution is now being offered at a specific bundled rate to the ManAd clients. And so please feel free to reach out to your specific account consultant, customer success consultant, and we can take you through some of the use cases that groups like Within and others are utilizing to achieve compliance and sustainable operations around ManAd management. And certainly with our applications, and we'll continue, is that we really focus on enabling you to be in control of your data so that in this ANAC operation world, you are in control of your future and those operations. And that really extends into really the legacy of ManAd plus around all aspects of that, all aspects of the system. So we can handle the complexities that you don't get funded for. We are driven by the people, not just data at the same time. And that we also focus on turning insights that really drive the results. And really, we can support either a solution around you or just provide a system and the adequate training for your teams. And the last two items, we're also extending some bundling of the capital management reports that we've been delivering for the sector, but we're including with that also a care and funding analysis report. So these are reports that we can take you through, but also generate for each of your racks. They lead to really driving improved capital management strategies or even capital planning around some of those services that Ben was noting that we are now focused on outside of just the ANAC revenue, but ties into what our competitors are doing around us in terms of additional services or higher everyday learning fees, what offerings they have, as well as what are the RAD and DAP makeups and achievements that we can see from the aggregation of the data across the country. And with our clinical teams, we are extending our regulatory reforms explain training. So this is a great course that does carry 3 CPD points, and it can be done 100% online, and it gives you dedicated access to some of our quality clinical consultants that will really help drive adoption of the strength and quality standards within your facilities. So please don't miss out, and these can be found on the Mirus Academy, and I believe also the links on the ManAd websites that we have. And the last offer that we're also extending to is that with the access to the data around your applications, ManAd, as well as a couple other care management systems, Alino being one of the ManAd clients that we have supported through this journey of really engaging agentics, which is a practice of taking machine learning or other AI or generative AI tactics or automation to really put the data at work in a world where a lot of the reform and reporting of these outcomes are starting to consume a lot of time. And this is a actual benefit change of a quality team at Alino, saving them 80 hours a month down to 3 minutes for their national population of the NQIP reports. So we can speak to you more about these benefits and these use cases, but this is all about advancing technology and driving more efficient operations and less use of your direct care eligible time on those non-direct care activities. And last, before closing for some of the questions from the chat, we've also launched every October the Age Care Effectiveness Index, which is commonly referred to as the ACE index. And we're doing that with our partner, Stuart Brown, and their data to provide insights and inform the sector, as well as other stakeholders you may have, such as your boards and other external participants around your effectively aged care effectiveness of operations and quality. And this is a national index that we do, but each of your individual facilities will have an individual ACE index that we can generate each quarter to demonstrate how you are aligning to the National Aged Care Effectiveness Index. So it's all about putting the data into ports for us to have conversations about our operations, conversations about areas that we want to improve upon, and having a national data set that we can really track and provide a basis of measurement as we continue this transformation. So I may hand over to the chat. I know we're just a couple minutes over here, Ben, but wanted to, I guess, throw over to Jackie or Mark on the chat line to see if there's any further questions that came up through the discussion or any of the topics, or maybe if you had any other comments, Ben, that you wanted to add just for the teams and for the individuals listening in on our conversation webinar today.
Yeah, look, I'd just like to add that I hope all of our clients see the benefit and the partnership with Mirus and the benefits it's going to bring to them, bring to the product and the platforms and the other services that they'll be able to now access through this partnership. We're all excited in the ManAd team here as we continue to work through, obviously, the current project with version 5 and getting towards the 1 July deadline, but then also really excited about the web project that we've also started that's being worked on off to the side, and we want to bring all of our clients along that journey. So as I said, if you've ever got questions, suggestions, feedback, features you'd like to see as we bring all of our options across into a full web SaaS offering, we will bring you along that journey and we want you involved. So please reach out, and then we'll also in the future obviously schedule a number of these things to highlight to you what's coming, what we're working on, and get some more interaction as well within the whole client group as well.
That's exciting. And any updates yet on the department? I mean, the last call we had, I think we are hearing that July 1 is still the date of which.
I'm sure everyone would hope that it would get pushed out, but all their communications is still 1 July is the date, and it's not getting pushed. But there's still a lot of work from their side that's got to come through, especially around the final legislation, which we're all eagerly waiting. And looking like there's no question. So I'm assuming we've done a great job and answered everyone's questions. If you don't want to ask questions in this forum, that's fine as well. You've got our usual channels. So if you want to contact us, you've also got our 1300 number, our support@manad.com.au email address. And you've also got your client managers as well that you're more than welcome to raise questions or ask things of them as well, as we sort of explain more and more over the coming months of what we're working on.
Absolutely. Well, thank you all for your time, and we will continue to communicate with you through those channels. And please follow us on our mail and other regular blogs if you haven't done so already. Great way for us to keep you up to date with what we're also hearing from the sector, as well as from our contacts within the Safety Quality Commission, Department of Health, and the wider stakeholder community of our operations. Thank you for your time today, and have a wonderful afternoon.
Thanks, everyone.